Today we're going to look at the commercialisation of public services. Now, in this climate of cuts, of outsourcing and so on, this may seem a climate where this is worth considering. Now, in the studio today is Professor Keith Goffin. Now, Keith, you've done some research in this area and you've come up with some surprising findings.
Yes, we've done two phases of the research. We did a survey of civil servants in the UK, their views on innovation in public sector. What could you do to innovate? What were ways of actually saving costs and coming up with improved ways of offering services? So we did a survey of views on the process of innovation within the public sector. And the other thing was we had a look at a couple of case studies from that survey, a couple of examples where people said this is leading edge, this is a type of innovation in the public sector that's really good. And that particular type of innovation was so-called commercialisation. And that was the interesting thing, because commercialisation is public sector, part of a public sector organisation, some particular capability or skill that's got, linked together with a commercial partner, and the two together come up with something that's far greater than either. So this is very different to some of the typical ways that public sector, both in the UK but also around the world, because just about every country has got to cut its spending on the public sector, on public services. But most countries, and a lot of the focus in the UK at the moment, is cutting services or outsourcing. Commercialisation is actually a different approach, which actually is very, very interesting if public sector organisations can actually develop the right approaches to implement commercialisation.
So in other words, there is a bit of a third way here, neither cuts nor outsourcing. Now, give me some examples of the ones that you looked at briefly.
Okay, there were a couple of examples. We had a look at public sector required broadband in Wales. Wales is relatively lowly populated, certain centres of population, we've got the cities, but then very large rural areas as well. For a commercial organisation to provide broadband access for all of that area was not actually something they're interested in. But the public sector needed it, obviously, to link out councils, healthcare, emergency services. There's a real need there. Now, when you brought those two together, you could actually find a way where it was interesting for the commercial organisation to invest in helping to develop this infrastructure that was supporting then not just consumer access to the internet, but also some of these services as well. So once again, two organisations come together, identified joint capabilities and skills which can be put together to address a particular need. The other one we had a look at was the Meteorological Office. So the Met Office has obviously got a huge history of analysing weather data. Now, what they actually recognised was that a number of diseases, particularly respiratory ones, are influenced by the weather. And very often people have severe respiratory problems. If it's particular types of weather, they'll feel ill, and they're actually large when there's particular types of weather. Lots of people go to hospitals and want to be actually checked, am I okay? Now, what the Met Office recognised, and then working with a commercial company that offers medical data analysis and provision, was that if these people could be warned in advance, particular weather conditions coming, you will feel this way, they are less likely to go to hospitals. Now, that saves a lot of costs of people being checked out, etc. So it works very well together. But the Met Office on its own didn't have the contacts and the links to the healthcare that would work in a particularly good way. Originally, they worked with UK hospitals and offered it as a particular service that was free. Then when they had to start charging, hospitals didn't see the value. Another organisation, commercial organisation, could make the link that made this service interesting for hospitals and also a revenue generator for the Met Office and the taxpayer.
Now, these sound like marriages made in heaven, but let's look at the practicalities of this, because I can certainly see some behind the scenes there.
Yep, and that's where we did these case studies where people have told us these are great examples of where it's worked, but also in the survey work we looked at what are some of the barriers to this type of thing, and what we recognised there was that in the public sector, from our survey we got very clear data that commercial organisations are viewed very sceptically by a lot of the civil servants, for good reason, because things like the private finance initiative, some of those examples have not worked particularly well. Examples, hospitals that have been built, financed by commercial organisations. These have been built, and actually some of the negotiations have led to relatively high rental costs, etc., which have then been quite negative for the public sector. Now, what we're saying with commercialisation, it's different. From the beginning, you're looking to bring the two organisations together and openly identify what can these two organisations together provide in terms of services, and how can the revenues be fairly divided from day one. Now, that's a challenge, but if you openly go in with, let's look at the advantages for the public sector and the taxpayer and the commercial organisation, share fairly, be very open book in the approach to it, you can be successful. The problem is, though, that a lot of civil servants have not been trained in that type of negotiation, and because of that, they're very wary of the private sector. If we can bring them together in a positive way and provide that training, and in the survey, people said, senior civil servants and middle managers in the civil service, are saying, we need training on this. Yes, we recognise there's some very good examples like the Met Office on this, but we need the training to be able to do it.
Keith, thank you very much. I think there's some great possibilities there, and I think it's an idea well worth pursuing. Thank you.
Thanks, Steve.